we will address some very important topics about improving the health outcome of our Afghan newcomers. So my name is Sally Dai. I'm a graduate student here working on my master's degree in international development here at AU. The focus of my research is on global health. And before we start, please allow me to recap in what happened in 2021 and give some background information of my study. The Taliban completed the takeover of Afghanistan on August 15, 2021. In just 15 days, US troops completed their withdrawal, ending the 20 years war. In September 2021, approximately 76,000 Afghans were evacuated to the US. Today, thousands of Afghans have settled in Maryland and Virginia. Many face critical challenge to resettlement, including struggling with emotional, psychological, and social well-being. I started my study during that time. My study is on the relationship between the educational level and the health outcome of our new neighbors. During the last few months, I interviewed several of them, and I realized that they're facing many other barriers to achieve optimal health. An array of other stumbling blocks have impeded them from attaining good health. For example, language barriers, economic opportunities, and mental health challenges due to trauma. So finding suitable employments that matches their skills and qualification is a major challenge. Often overseas credentials are not recognized in the US. Lack of income impairs their ability to pay for healthcare and even being insured. So many Afghan newcomers have already experienced traumatic events, such as displacement, loss, and conflict, all affecting their mental health and well-being, and cultural stigmas surrounding mental health hinder their access to quality of medical care. All of those needs led the WCIE to host this workshop today. And this is an ongoing research project. Please contact me if you are interested to participate so that we can help our new neighbors in the DMV to obtain their better health outcome. And I left my name card outside, so if you're interested, please pick up the name card. Thank you. And back to Prof.
Okay, great. Thanks. So our first speaker will be joined by Bashir Mobasher, who's a postdoc fellow here at our university with a position in the lab. Has a background in legal studies, constitutional law, but a perspective of systems and how today we'll start from a perspective of how the systems, Afghan and US health systems, perhaps are not aligned in different ways to influence access to care, barriers to care. Professor Bashir, welcome. Thank you so much.
All right, thank you very much. Good afternoon, everyone. As you suggested, I'm not an expert on healthcare system, but we do have experts here. So if you find that I say something wrong, please don't
right away.
Just ask me. And you have the slides up, or you can just. So what I'm going to try to do is basically to compare, show the differences between the healthcare system in Afghanistan and healthcare system in the United States, and how does that make it difficult for Afghans to familiarize with the healthcare system in the United States and understand it, and at the same time to receive the health services in the United States. So one of the big things, I'm going to start with the biggest matters. So for example, in Afghanistan, we didn't have primary or, for example, public or private insurance. So this whole concept is very new for Afghan refugees who are in the United States, who have to receive, for example, either public or private. Insurance. And health insurance is a very complex topic, right? So for example, whether you get Medicaid, Medicare, for example, private insurance, it depends on your eligibility, your income. But at the same time, what kind of plan do you receive, and the issue of, for example, deductibles and things like that is very complex issues. So for most of the Afghan new refugees, it's very difficult to understand it and then utilize it in their favor in terms of receiving, for example, health services. That's one of the things. And there's one reason for that, and I'm going to come back to that a little bit later. The other thing, for example, the other big difference which you would see is mostly, for example, technological, for example, online and digital services, medical services. If you compare between Afghanistan and the United States, so for example, right here you have these apps for health services where you can get notifications, you get messages, you send messages to your doctor. For example, you and get appointments, right? You also ask, for example, for refills and things like that. Things that do not exist in Afghanistan. So it's something that makes it easy for Afghan refugees to utilize to receive health services, but at the same time, it's something new. So they have to learn about that. They have to, understand how this app works. And for example, one other big difference which I think is very consequential in terms of the health of the Afghans in Afghanistan and in the United States is, for example, the issue of universal system or universal health records of for example, the patient. So in Afghanistan, so for example, you would go to different doctors, they would give you different prescriptions. If you go to a new doctor, you would have to bring your new prescriptions. So for example, your medicine with you to show to them. They do not necessarily have access to the history of your medical records, for example, to understand what medicines you took already, probably what kind of allergy do you have against different types of medicines. So they are not necessarily aware of. And mostly people after the treatment is done, they would get rid of the prescriptions, and the next time they go, they have nothing with them to the new doctor. So that's one big difference, which I think in terms of receiving better healthcare services, it's better in the United States compared to what they're receiving in Afghanistan. The other issues, for example, the issue of I'm sorry, I'm looking at here. Okay, the primary care provider. So in Afghanistan, you do not have primary care provider or family physician or whatever you term it. Usually people would jump from one doctor to the next doctors by receiving some reviews from friends, or for example, by not okay, awesome. All right, thank you. So that's another big difference, and it's important to have a primary care provider because they know your history, they know your record. They also introduce you possibly to new doctors if you're supposed to go to new doctors. So that's important, but you don't usually have it in Afghanistan, which and basically most of the things I'm talking about are basically based on a survey of 25 individuals who have migrated to US. They have experienced, the medical system in Afghanistan, and they've experienced medical system in the United States. And so 25 people is scientifically not necessarily representative of all people of Afghanistan or all Afghan refugees in the United States. But that does give us a small window. So I did talk a little bit about that with professionals. I got some insight about that from the professionals as well. So the numbers you see in front of these different items is the number of individuals who complained about the particular issue with for example, with the healthcare system either in Afghanistan or in the United States. People have also complained about, for example, the numbers of quality of doctors in Afghanistan versus the United States, for example, about the communication of, for example, although there is language barriers, they seem to be happier with how they are communicated with the professionals in the United States than in Afghanistan. And also some people have complain about, for example, inaccurate diagnosis or inaccurate treatments and things like that. Now, people have also had some difficulties, as I began my presentation with the fact that they had some difficulties with receiving medical services in the United States. So one of the biggest complaint is the high cost of medical services in the United States. So in Afghanistan, constitutionally, the government was responsible for providing free healthcare services for the public. So, for example, if you look at Article 52, which is in the bottom of the right corner, the state shall provide free preventive care and treatment of diseases as well as medical facilities. So we have state hospitals, different big cities and the capital of different provinces, but then we have these public medical clinics in different part of the country and the rural areas where people could receive medical services for free. Now, that's perhaps one of the reasons why insurance has not become a popular thing, a big thing in Afghanistan. It was universal in the sense that it wasn't really depend on the income of individuals, so everyone could utilize that, but mostly poor people would utilize that. And then we had the private hospitals and clinics would provide, in some cases, better quality, for example, medical services with high fees and, with lots of charges. And that's one of the things. So, for example, most of the people who fled from Afghanistan, who came to the United States or went to different parts of the world, they're mostly people, particularly people who have fled to the United States, were well off in Afghanistan, who work, for example, with the international organizations, with big companies, judges, professionals in different fields. So they could actually go to private hospitals and pay for that. So even for them, in case of the United States, the medical service is very costly. And one of the thing about medical services to have insurance, right? So it's not just recommended to cover the expenses of your health services, but it's also mandatory by law. And if you don't get insurance in the United States, you'll get fines once you file your taxes, right? So and insurance is very costly unless you get, for example, Medicaid, for which you have to be qualified and eligible, and you have to have certain level of income depending on, for example, the number of people you have in your family. So that's one thing. And dental care was, again, there was a complaint about the dental care in the United States being very costly. Some people actually travel to, for example, India. I've heard about some people traveling to India or Turkey to receive dental services. Looking at the cost of the whole travel, flights and accommodations and everything, and still that being cheaper than dental care in the US, that seems, that does tell us a lot about, the cost of dental care. And the issue of accessibility, again, there is an issue in the United States as well. For example, the language barriers, not everyone who has traveled, came to the United States know English. So there is barrier with that. Longer appointment is another thing that around at least 5 people have complained about it. Well, you usually here you make appointments by phone call, by apps, or by, for example, emails, and usually takes you, I don't know, a while, right? But in Afghanistan, it's usually walk-in. So even for the most popular doctors or hospitals, you go in the morning, you get a number which does tell you where you are in a queue or in a line, and then you go on the evening and get your, or whatever treatment you want to get. But here it takes them a long while. So that's the other aspect of it. And one aspect is mostly cultural in case of Afghanistan as well as legal. So in case of the United States, if you want to receive some medicine, some pills, let's say some pills, for example, from pharmacy, you need to have, for most of the pills, you need to have a prescription from a doctor. That's not necessarily the case for Afghanistan, except for a few medicine which are considered highly dangerous or for different other reasons. Most of the medicines you can just go to a pharmacy and get them without having any prescriptions. And that's one of the complaints of Afghans we do not have access to medicines. And the same easy way as we did in Afghanistan, I wouldn't consider it something, negative about US, but that's, how the Afghans are used to this. And the other thing is, I believe, and I may be wrong about this, Afghans were overconfident about the medicine and about their knowledge of medicine, right? So they're confident about the medicine in the sense, they would take whatever medicine, headache, whatever, you just take medicine. But at the same time, they mostly think they're doctors and they know, if you're headache, take this, if you're stomachache, you take this, so you don't need a doctor. And my mom is a really good example of that. She chews like medicines, like you take cookies every night. And I wasn't able to convince her. And my elder brother is a doctor. He couldn't convince her either. So she just takes medicines and she prescribes medicines to us, the family members, right? Something you don't have, for example, that kind of conception in the United States. So that's one big, I would say, perhaps cultural difference, that makes some consequential differences in terms of, receiving medical services between the two countries. So I'm gonna just end here, and I hope I was following the timeline.
Yeah, great. So what we'll do, we'll try to keep a little bit of time at the end for all of the panelists to be able to take questions. But if we could take a couple questions now, if anybody would like to pose a question for